want to introduce our first speaker. Brittany Nelson is with Shepherd Insurance, and if you missed her talking a moment ago, it's 50 degrees where she's at, but she's not in Florida. She's in Indiana, so I figured it'd be a lot colder, so good for you, Brittany. Brittany is the Director of Population Health and Wellbeing with Shepherd Insurance, and so grateful that she's able to give this presentation today. Thanks, Brittany, for doing this and taking her time. I'll pass it off to you now.
Thank you so much, John, and thank you everyone for allowing me to speak to you today about actually a subject of wellness or well-being that I'm actually very passionate about as well. So I'm going to share my screen. Stick with me because I have to do this in a process that I know how to do or I'll mess it up. Let me start the presentation. That look good, John?
Yes, it does.
Okay. So today we're talking about EAPs or Employee Assistance Programs. And I'm going to speak briefly. There's a lot that goes into these, and they can be very personal as well-being is to your people. So that's one thing to think about as I go through the presentation I have here today for you. But some topics we're going to talk about is, what is an EAP? What does it stand for? How long have they been around? Then why have an EAP? So I always like to start with the why before we talk about anything we want to do. We need to know why we need to do it. Next, how employers that we work with primarily offer employees an EAP option and what we've seen as best practices. And then also finally assessing and evaluating your EAP, which is really important to do with any type of wellness or well-being program that you may put in place with your for your employees. So what is an EAP? It's an early intervention. So it's an early intervention. It helps identify personal and behavioral problems that could adversely affect or impact the employer. And so just the good old definition to start off with. Historically, though, it's been primarily for individuals with personal problems, but specifically around substance abuse. So we see a lot of that changing, not necessarily being so much about individuals that have mental health issues or mental health problems, or even individuals that have substance abuse, but really more holistic now. And you can see that in this next slide with the typical areas that an EAP addresses. And so it's anything from alcohol, substance abuse, like we talked about, which it was historically the prime reason to have an EAP or to provide an EAP referral, to childcare and helping, your employees, manage the childcare issues we have in today, to gambling addictions, eating disorders, depression, anxiety is on there, legal counsel. So it's kind of a wide variety and takes more of a holistic approach now to really supporting the person so that early intervention can really take place. Next, we focus on why an EAP. I think John had put on LinkedIn and some of the promotional pieces a lot of the financial impacts around mental health. I'm not going to share those today because they're huge numbers, but they're important numbers. But I will share this because it's a little bit easier to understand in your organization. If you have 20 employees in your organization, know that 5 are experiencing a mental health concern. So, or a substance abuse concern. If you have more than 20 employees in your organization, you can double and triple those numbers. And so it's a lot of people that are going through a lot of things. And what's really surprising is that less than 20 of those, so 1 in 20, will actually get the support that they need. And that's what's the striking number. And you ask yourself, why? Why aren't our people able to get the support that they need? And that's I guess, with the numbers, $1 million question of why aren't they getting that support? And some of it comes down to access, knowledge, but then some of it also comes down to, what's available to them within their benefits, within their employer that maybe they don't know about. So some potential benefits for employers that have an employee assistance program is they've been shown to show a decrease in employee turnover, employees being absent, They show a decrease in long-term disability for workers, compensation, accidents, all decreases in those things that a lot of us in HR will track. They show a decrease in they can show a decrease in medical plan spend, sick leave, training new hires, and then also an increase in employee performance, productivity, morale, and relationships with coworkers. So I think one statistic that I didn't put on here that I like as well is the average U.S. employee is spending 53 hours a year resolving personal issues on the job. So, 53 hours of extended work week, we'll say, for some of us. That's what is being spent a year on dealing with personal problems. And then the question that I would love all of us to really think about within our workplaces is if something from a crisis or traumatic standpoint happens to your employees tomorrow. This could be an injury in the workplace, a bad diagnosis. I mean, we all see the news of everything going on in our world today. Who will you turn to? So do you have someone that has experience in critical incident stress management to come into your workplace and debrief with your employees so that they feel supported and that they feel that they can be resilient through this this traumatic experience or this issue that had gone on? So if you don't have that question answered, hopefully you have some ideas at the end of this presentation today of how you could get that answered. And it could be as minimal of, I'm going to look into it, and my goal is by next week is to have that question answered, and contact John, myself, Dr. Watts, Todd, and we can help you answer that question. But it's really important because what we don't want is to be reactive in these situations. We want to be preventative and have a plan in place before they occur, because more than likely at some point they're going to occur. So some EAP options that we really focus on that we help our clients at Shepherd Insurance obtain, I want to speak to next. A lot of times an employee assistance program is offered alongside a long-term or short-term disability policy. So if you currently have or offer long-term or short-term disability to your employees in your total benefits package, that's something to talk to your benefit advisor or the insurance company that it's through, the vendor that's through, of, is an EAP already embedded in this program? Do I already have one? Or if you don't, how much would it be? Learning more about what EAP third party they may work with. We've noticed that this is the most cost-effective approach at times. And so sometimes starting here with your short-term and long-term disability policies is a good place. The other option would be, we have seen that employer-paid life insurance plan policies can also tack on an EAP as well. So that's, again, a reason to talk to your benefit advisor about what are some options you have if you provide these types of benefits already. And, when you think about the context of employee benefits, there's a lot of situations that are linked together. I just had a baby a year ago, so I'm gonna use myself as an example. But, whenever I had a baby, I went out on short-term disability for that. And when mothers have babies, a lot of times there's postpartum issues that go on, mental, whether it's postpartum depression or, not getting any sleep, whatever it might be. So having a EAP attached to that short-term disability and being that same company, I'm able to not only have the short-term disability, it's the same name that I go to for my EAP. So it's kind of tied together when it comes to disability of your employees and why they may not be at work and the support they can have during that time. So like we talked about, make sure you don't have an EAP already in place. And then if you do already have one in place and you're utilizing it, the buy-up options are possible. So we'll talk a little bit about that a lot of times. And then some employers will make the EAP part of their benefits package, which I like that structure a little bit better, because you never know what someone or someone's family member may be going through. And whenever you only wait till an employee faces a challenge to provide them information about the EAP, they may never tell you that challenge. And so having it be a part of their overall benefits package is good. But then also knowing, when you can refer employees and making sure managers, supervisors are equipped to knowing how to do that as well. Another area that we see employee assistance programs being offered is within medical insurance. So like carrier resources. So I believe in Sarasota, that's your Blue Cross Blue Shield, your Aetnas. A lot of times within your health insurance policy, medical insurance policy, you'll be able to tack on again per member per month and be able to be offered a employee assistance program through that as well. And then you have your EAP standalone options. So the two organizations here on the left, the International Employee Assistance Professionals Association and the International Association of Employee Assistance Professionals in Education. You could probably just Google IAEAPE and find that. But those are two websites. You can kind of look at like where you're located, what type of EAP you want, and they'll come bring up a variety of different EAP options for you. Also knowing what you have locally there in Sarasota, Samaritan is a great option, and Todd and Dr. Watts are going to talk more about that. And then over here on the right are just a variety of different EAP options that are really common, and Shepherd can support you in knowing more about those EAP options if you have more questions about one or a few specifically. But EAP standalones are possible as well. You know, one question I get a lot of times are, you know, my company doesn't offer medical insurance to our employees. We don't offer any disability. You know, maybe we only have 10 employees. What could we do? And with that, I would recommend going to the EAPA or the IAEAPE. But then also there are some standalone options in terms of like, probably see commercials on like BetterHelp, the Calm app, things like that. Those are all options as well. We just don't have a lot of experience with those. And so that's why I didn't put them on here. Other EAP program options that to be mindful of is, you know, how many counseling sessions are included. So previously I talked about buy-up options. So maybe you already have an employee assistance program embedded, you know, your employees are using it, but you've been getting a lot of feedback about, you know, I only get 3 sessions. I wish I could get 5. There's a barrier, like I get involved with a counselor and then I have to stop. And so there are more that you could buy up to in some of these EAPs. But it is also important to know the language that your employee assistance program is using, because a lot of times there's pointed out as 3 to 5 per stressor. And so it could be unlimited if the individual has many stressors, as myself and most of us do. Are they in person? Are they virtual? Are they digital? So there's this new thing called computerized cognitive behavioral therapy. So this would be for an option for employees that may not be ready to talk to a live person. Maybe they just want to get some education around mental health. And so this is more of an AI kind of feel for cognitive behavioral therapy that has really, really taken off. And then what else is provided? So is there will creation? That's a big one for a lot of employees, or estate planning involved in the EAP. And then is it available 24/7, 365, right? The last thing I'll say on this slide is if you do have an EAP, I would recommend testing it out yourself. So calling the EAP phone number, checking out what it is like in person or it's like virtual, so you can really be an advocate for it. And then knowing your people, using empathy. So empathy is one of those pieces we use a lot in mental well-being space. And, you know, if someone isn't showing up to work or if someone's productivity is decreasing, taking it from an empathy standpoint and knowing what your employees need is important when you're thinking about the EAP that you'd like to offer or the type of EAP you'd like to offer. So this can include having stay interviews. You know, if a company has exit interviews, they probably should have stay interviews. So understanding stay interviews, one-on-one discussions, maybe surveying your people and understanding the barriers that they may face to being able to obtain mental health support is important. Kind of flying through this because I know my time's coming to an end. But some EAP metrics to track. I just wanted to kind of share some of these. The first one being operation cost of the EAP. So that's something to think about. I like to put that as number 1, because if your operation costs of an EAP are pretty low, then some of these other metrics may not be as as needed, depending on, what you want to do from a strategy standpoint. If your operation cost of your EAP are really high, then maybe setting some of these goals, whether that's with a wellness professional or the EAP, to say, what do we want this EAP to accomplish within the next year? What do we want this EAP to accomplish within the next 5 years? So if you have a high cost that you're putting in place, what is it going to accomplish? And these are some, I guess, metrics that may be an idea for you to track. And this is something we really help our clients with. I know, holding kind of that accountability with the EAP vendor. This slide is just specific to employers that use I guess, mandatory EAP referrals. So if you are an employer that mandates EAP referrals within your company, I would highly recommend talking to a benefits professional and just making sure that everything is compliant under the ADA. So next steps to take would be assess the need for an EAP. If you don't already offer one, assessing your people, again, those state interviews, one-on-one surveying your people to see what is of need, knowing that 5 and 20 are of need. Then knowing the benefits that you already do offer, what is available, talking to your benefits professional to make sure something's not already embedded that you're paying for that you might not know about. Talking with the benefits professional, ensuring your employees and family knows about the EAP. A lot of these EAPs are available to all employees, not just those on the health plan. It's all employees and the people they live with. So that includes their entire household. And then creating a strategy. So like I talked about, knowing those metrics to track and, having some help to do so that what is success year after year of your EAP. If you have any questions, I know I kind of I looked at the time and I was like, whoa, I got 2 more minutes. So if you have any questions about what I talked about, or if you need support around, creating a strategy of metrics to track with the EAP you have, if you have questions about how to implement or embed an EAP into a insurance policy that you have, please let us know. My name again is Brittany Nelson. Our executive partner, president of benefits, is Steve Gregory. And then down in Florida is our CEO of our Florida region, Patrick Del Medigo. And so we are all experts on this and would love to speak to you if you have further questions.
Thank you, Brittany. And you didn't have to fly that fast. You got through it. That's all. That was great.
Okay, good. I was like, oh no,
you're good. That actually gives us time, to honor any questions that people may have. I'll start, but before I start, I know I saw Kelly also. Kelly's on here in Sarasota. So if any of the Shepherd staff just want to put your contact information in the chat so people can follow up with you if they would like, feel free to do that. Brittany, when you mentioned the slide about per stressor, can you give us examples of what that just looks like and examples of stressors?
Yeah. So when you think about, someone having stress, right? I have so much stress in my life. Well, that stress, when I think of it, I think of, a thunderstorm, right? And a cloud of stress. Well, within that thunderstorm is rain, and the rain is the stressors. And there's even maybe some lightning, which are really big stressors going on. And so one stressor could be your kid is going off to college. Another stressor could be your dog just passed away. Another stressor could be, you keep forgetting to brush your teeth, and that's just driving you crazy. And so when it comes to these employee assistance programs, they aren't doing 3 sessions per stress, the cloud. No, they're going to support you 3 sessions per raindrop. So what a lot of employees don't know, if it's set up that way, which a lot of them are, is they can talk to that counselor 3 times about their child going off to college, that raindrop. They can talk to their employee or their counselor, 3 times about their dog passing away. That's another raindrop. So that the idea is supporting a little bit at a time, 3 sessions with each of these stressors, that their clouds become more clear and we don't have those lightning bolts. So hopefully that helps make sense of that.
Yeah, I had no idea that was a thing. So that's really helpful for anyone on the screen to know to check that out with your benefits people. I don't see any questions in the chat box. Anybody have one that you want to just come off mute and ask your question? All right, I did put two things in the chat box. I put a link to Brittany's LinkedIn page, as well as to a webinar that is on Shepherd's Insurance website that she did last year called How Wellbeing Will Impact Your Business. I encourage you to check that out as well. And again, thank you, Brittany, for being with us today and sharing this really important information. Now, everything she just talked about, I think she would use the term that's standard EAP information, right, Brittany? Okay. So now I'm going to introduce Dr. Dan Watts. He's going to give us an illustration of a creative EAP way that he's produced there at his company, his practice. Dr. Dan has a practice here in Sarasota called the Renewal Point. He's been practicing medicine, according to your website, it's over 35 years, right, Dr. Dan?
It's over. I didn't want to say how long because people think I'm too old.
Yeah. So he's here today to give us an illustration of, well, first of all, to tell us why this is so important to him personally and his family, but also what he's provided for his staff there at the Renewal Point. So thank you, Dr. Dan, for being with us and giving us another look at how this could be played out at our companies. The time is yours now.
Thanks, John. I picked up on Brittany's. She broadened my scope as to what the CAP is, because I think you'll find we narrow it down a little bit in our office, but it works well for us. But thanks for inviting me to talk to you on behalf of the Samaritan Counseling, and specifically the Employee Assistance Program. I'm a physician, like John said. I've been practicing for 52 years, so I started off pretty early. We did hear of somebody, what did we say, Sherry, that's been practicing since they're 106 or something, so they beat me on it. Let me begin by disclosing that I have a bias in speaking about Samaritan. I love Samaritan, what it's done for my family, my office, and our community of Sarasota. I only have 15 minutes, and so I'm just going to limit my discussion to only 3 things. And I'm going to kind of dovetail into what Brittany said, because we, as I said, narrow that scope. We only cover assistance programs for behavioral mental health. So you'll see a little difference there. So number one, why is we as humans might want to consider seeing a professional counselor at all. Number two, why you might want to use Samaritan Counseling. And number 3, how your office can benefit from having a counseling referral program. Sherry, my wife, and she's on right now, and I have had a long history of using counseling in our marriage and family, mostly when we couldn't work things out on our own. I grew up in a family that dealt with severe mental problems, and as a result suffered general anxiety and severe panic disorder in my younger life. Sherry came from a history of sex abuse beginning early in her life. We loved each other and wanted to start a family, but realized both of us brought a lot of skeletons to the relationship that could be dangerous for a long-term commitment. Luckily, we were referred to a great counselor who helped us through some of the early pitfalls of marriage. And as a result, we've been married for 45 years. Yay, Sherry. Hold your hand up. Not that we haven't had to reach out for tune-ups from time to time. So let me talk about stress and how it might affect your own life and the life of your employees and the health of your office. Now, Brittany touched on this a bit, but think about it. How many of us have stress in your life or have it show up as being detrimental to the running of your office? The truth is we all have stress. It's a part of normal life, and most of us just learn to cope with it. Our bodies, it seems, were built to handle short-term stress, but when it comes to persistent, overwhelming, pedal-to-the-metal stress, it becomes dangerous. Kind of like that storm that Brittany was talking about, and the lightning and all the rain and wind. In these cases, it's sometimes beneficial to seek out a professional support. For instance, in dealing with grief and unresolved issues, with anger, finding balance in your life, learning better ways to communicate with others. A startling fact is, and this is medical fact, is that 75% of all medical problems can be related either directly or indirectly to stress. And we're not talking about just mental problems like anxiety, depression, or panic disorder like I had. We're talking about heart disease, GI upset, migraines, Alzheimer's, diabetes, cancer, and a lowered immune system, which cause a lot of sick employees. And the cost to your office can be huge. It can result in poor communications among the staff, more days absent from illness, decreased productivity, decrease in morale, increased staff turnover, less congenial atmosphere at your work, more customer relationships, less sales, and the list goes on. I manage a small office of 12 employees composed of nurses and administrative staff. We see the usual stresses, marriage problems, problems with the kids or other family members, rifts between employees, financial problems, and these can all be dangerous, causing depression, anxiety, bickering, snappiness that can filter down to the patients, especially the nursing and staff that deal directly with the public, like on the phones or directly with the public. I spoke to a young friend of mine recently about this issue. He manages a small business of over 25 employees, a lot younger staff than mine. He tells me that his worst management issues come from drug abuse, alcohol, and anger problems, creating grumpy employees and poor productivity. In both cases, it costs the business in time and money. Over the years as a physician, I've referred many patients, family, staff members for psychiatric and psychological counseling. So a word about psychiatric drugs. I'm more of a naturalist doctor, but I totally believe I'm not against drugs, psychiatric drugs at all. I took them when I was younger and contemplating suicide. I didn't kill myself, so here I am. But in many times, these drugs do not get to the root cause of the problem. Over the years, I've been proud to refer to Samaritan Center of the Gulf Coast. Samaritan employs over 35 excellent professional counselors here in our area in multiple locations throughout Sarasota County. And I believe, John, we're in other counties as well. I think Bradenton or Manatee. They offer ongoing training to their staff, keeping up with the latest in psychological health. They offer counseling both in person and telemed, and they accept insurance. For the last 20 years, my office has offered an employee assistance program to encourage staff to get counseling when appropriate. And we found this method very cost effective. The employee assistance programs helps my employee cover the cost of their counseling if insurance doesn't. And we have an insurance that we offer our employees. They can get it or not, but we never know exactly what their benefits are till they actually try it out. Specifically in our case, we first get an agreement from the staff member that they would be open to counseling. We then call an intake advisor at Samaritan and make a referral. If insurance does not cover the cost, our cost will make a donation to Samaritan. As an example, we had two extremely valuable employees having a difficult time, and I'll call it constructive communication with each other. They were fighting and bickering, okay? I'm sure this happens in all office, but in our case, we were near firing these two. However, we knew that in each case, they were going through personal problems and crisis at home, then bringing their home life into the office, affecting the running of our office. We made the referral to Samaritan through the employee assistance program, which helped out. Each employee was assigned an excellent counselor. Not only were we able to save both employees, but each personally benefit, and so did their families. In closing, we're grateful to have Samaritan's partnership in transforming the lives of our staff, their families, and for all they've done for our families. I encourage all business owners to call Samaritan for professional counseling support and for their staff that deserve it. So that's it, John. I'm open for questions now.
Yes, definitely. If you have a question you want to put it in the chat box, certainly go ahead. I have one to lead with. How do you, I'm assuming this is like a budget line item in your annual budget. Can you talk about how do you, if that's true and how you determine that each year?
How much money to put in the assistance program?
Right.
It is variable, John, but we've had, I Sherry and I were counting up probably over the last 20 years. We probably had 20 referrals, I think, to Samaritan Counseling, given family and office members. We don't necessarily do that. We don't necessarily have a budget line item for it. As I said, just the cost of not having to hire a new employee or keeping a real good employee around, keeping our employees well, mentally well and physically well, is we find is just so worth it in the long run.
Excellent. Any of the HR professionals on the screen have a question? I will throw out a stat. Brittany mentioned I had stats. I just looking up some things to be on the Suncoast View last week. I found a quote or a stat, excuse me, that says 200 million work hours annually are work days are lost due to depression. Just depression, 200 million work days. And the cost of that is 17 to 44 billion dollars. And that's just a staggering number. Of course, that's taken in a couple of countries. It's not just Florida by any means, but that's just knowing that is one stressor, like Brittany mentioned earlier, just one stressor. That this is an important thing. So I appreciate Dan and Sherry being with us today and giving some illustration of how this could work at your company, no matter the size of your company.
John, let me just mention one thing here. This is a book, if you can see the size of it.
Yeah.
It's listed in there, it's integrated medicine. It lists the top maybe 100 diseases or cases that you might deal with. And guess what the first two are? Depression and anxiety.
There you go.
They're the top ones that we deal with in medicine, and I'm sure in your case.
Of course, right. Okay, well, just because we're moving on doesn't mean if a question pops in your head, we can't come back to it. So if you something comes in your mind, you want to ask that question, certainly put it in the chat box. I'm going to go ahead and introduce our final presenter. Todd Warren is a clinician at Samaritan. He's a licensed mental health counselor, moved here from Ohio. So you're feeling pretty good about being in Florida versus Ohio, right, Todd?
Absolutely.
Yes.
Yeah.
So Todd is here just to give us some insight that when you, like you heard Dr. Watts say, he's referred employees to Samaritan. So it may cross your mind, what do I tell my employee when I'm referring them to any center, what to expect, the outcomes they might be hoping for, all those kinds of things. So Todd's going to give us some practical thoughts of how to prepare your employee and actually encourage them to come and share a story of success through an EAP referral. So Todd, it's yours.
Yeah, as John said, my name is Todd. Been a clinician for about 12 years now. Actually started out my career as a chaplain. Did chaplain work for about 8 years with a hospice center, and had similar programs to EAP through that experience. So I was kind of familiar with EAP going into my practice, but throughout the years of being a therapist, had several, dozens, probably hundreds of people that have come to me via an EAP program. Typically, in my experience, most people access their EAP program through their insurance. They'll call their insurance, or they'll be aware of an EAP program through the packet they got when they first were hired, or sometimes it is through their HR. And so there's a few things I'd like to mention just to prepare your employees as they access their EAP so that it goes smoothly. One thing that they'll need to do is obviously contact the EAP program and do an intake with them over the phone. Sometimes what we'll have is a client that'll come in, and about within the first 5-10 minutes, they'll say, well, I have EAP. And I'll say, okay, do you have an authorization code? Have you called your EAP? No, I haven't. And unfortunately, we're unable to honor that EAP until they get that authorization code. A lot of EAPs, actually, there are a few I'd probably say they're pretty rare that will actually expect the employee to contact the EAP company and get that authorization code before we can even schedule with them. That's just a few different EAP programs. That's not very common, but that does happen. So getting that EAP authorization code is really important. Otherwise, they'll either have to pay out of pocket or they'll have to use their insurance. They can still use their EAP, but it won't be until the next session or whenever they have that authorization code. So please encourage your employees to get that code before they come see us, because that just makes the process a little smoother for them and less frustrating for them, and so they can access that kind of care. Trying to think of some other things to mention about EAP programs. They're typically the EAP programs that I've seen over the years and have anywhere between 3 to 12 sessions. So they're going to be varying degrees of sessions that are approved. Oftentimes those can go pretty quickly. Some EAP programs will allow you to get another round of EAP sessions if that's applicable, especially if you uncover a different problem. Some people will come in and you'll, as clinicians, will diagnose them with an adjustment disorder, which is related to stress with either depression or anxiety or both. But sometimes something else will evolve while they're there. Maybe they have a death in the family suddenly, so now it's grief, or if we get more specific as to the diagnosis. So if they come in with anxiety and we diagnose them with a adjustment disorder with anxiety, it could turn into we might fit the criteria for generalized anxiety, and those kind of your worriers. So that could be considered a different problem. So sometimes they're able to get another round of EAP because of that. Usually after those sessions are completed, we will let them know about 2 or 3 sessions before they're done with their EAP that we're kind of getting to the end of that, and then we'll have a conversation about their insurance and checking in with their insurance to see what their benefits are, or possibly getting more EAP sessions. So we let them know about that. Or if it's going to be a termination of therapy because if things are resolved within those sessions, we'll terminate the treatment, and we'll tell them that they're happy to come back whenever they feel the need to come back. As far as a success story, recently had I'm going to get a little clinical here for a moment, so just bear with me. I had a client. She was a 46-year-old Caucasian female who came in, who was dealing with an adjustment disorder with anxiety. And she had her mother, who had just moved in with her and was going to be moving in with her full time. And that was a big adjustment for her. One of the reasons why she was seeking me out was because part of what I do, one of my specialties, is working with people that are in toxic relationships, that are in relationships where there's manipulation. Perhaps somebody is narcissistic, or one of the personality disorders. That's kind of where I find that I do my best work. And so she was dealing with someone like that. So we were able to work through that within about 6 or 7 sessions that she had, where setting boundaries. And when I was working as a clinician for the very first time, it was in community mental health. And I had my first borderline personality disorder client. And I had absolutely no idea what to do. I had heard about borderline personality disorder, but I'd never really encountered that. And it's a very difficult disorder, probably a very misunderstood disorder too. But I remember I was pulling my hair out. And I went to my supervisor, who happened to be 30 years a social worker. And I was telling her, and she smiled knowingly, and she shook her head. And I was saying, what do I do? How do I even treat this? And she said, well, the very first thing you do is you set boundaries. You set limits. And those aren't for them. Those are for you. Because if you don't, yeah, you are going to be pulling your hair out. Yeah, it's going to be difficult. So you have boundaries protect you. They help you be able to function in a way that's healthy and that makes that toxicity and that manipulation a lot less likely. And so that's what we worked on for the very first 3 or 4 sessions was just learning how to set boundaries. She was also at a place where she probably needed medication, so I encouraged her that, yeah, it's a tool in the toolbox. Feel free to talk to your primary care physician or even psychiatrist about that. Now, I don't make recommendations for medication, but if they feel like that's something they want to do, I certainly will encourage that. She did go and she was put on a low dose of an antidepressant, which was very helpful. And at the end of the therapy, at the end of the EAP sessions, I should say, she was feeling a lot better. She said that her relationship with her mother was starting to improve. She was starting to see some of the things that we had been talking about as far as how manipulation works. One tool that I use is the FOG, which stands for fear, obligation, and guilt, which is the tools of the manipulator. And she was able to start seeing those and be able to be more cognizant of those happening in her relationship, and also seeing how maybe she was mirroring back a little of those behaviors too. And so she started to take accountability for her own self and how she was functioning in that relationship too. The EAP sessions came to an end. We did end up, we are still continuing working together, but she says, I think it was even her last session, she said, I feel so much better than I did when I first walked in here. That being able to talk about these things and to be able to name what it was and to identify what it was and what it is was extremely helpful for her. So that's a success story that I have, one that was pretty recent in my work with that client. Yeah.
Well, that's really cool. When you were mentioning you bump up potentially to coming to the end of the sessions that the EAP is providing, you have that conversation. It made me want to ask this question. I know it's a question clinicians don't like, so I'll just, disclaim it, right there. But a common question people have is, how many sessions is it going to take for me to be fixed? That kind of question. And although it's annoying because there's no way to really give an answer to that, but I think there is at least an average expectation that we could throw out there. How would you answer that, Todd?
Sure. What I'll say, and of course, we typically will think like anywhere between 7 to 8 sessions, but the way I answer that is, well, it depends on how hard you want to work. Depends on how much you're going to put into it. One thing in case management that I learned a long time ago was you work just as hard as your client works. And so if you see your client putting in a lot of the hard work, you put in a lot of hard work too. And you match their energy. And so I'll tell people is like, well, it's all going to depend on, your goals, what we decide on as your goals, and how hard you're going to work in between sessions. Because while coming and seeing me for an hour session once a week or twice a month is going to be helpful, you're also going to have to be doing things in between sessions. So I'm a big advocate of giving homework, very small measurable things that people can do in between sessions that they can do on a consistent basis that'll bring about a change in their life. And I think when people have small measurable goals like that, and they start meeting them, it starts a momentum and they start to realize, oh, okay. There was a psychologist years ago, his name was Murray Bowen. He was a father of family systems theory, worked with a lot of families, a lot of couples. And what he would say is that if you can change 5% in the next year, you're probably doing really, really well. And I find that that's the case. It's like taking a pebble and dropping it in the water. The ripple effect has an effect. My faith tells me it's a grain of a mustard seed. The faith of a grain of a mustard seed can make a big difference in another person's life. So that's what I tell people. That's how I answer that question.
Very good. Thank you. If anyone has a question for Todd, specifically, then we'll open it back up to all three of them. Feel free to come off mute while I'm talking, and I'll be able to recognize that you have a question. I'm going to add in the chat a link to a page on our website at Samaritan that at the bottom of that page, you'll see the majority of the insurances that we take, just to give you an idea. If anything that Brittany shared about specific insurance companies, you might see a connection there. Now that some of those names aren't specific EAP names and logos that you'll see on there, but it'll at least give you an idea. And hopefully those HR professionals on the screen, you'll see the insurance companies that your employees already have. So when Brittany says, check out if there's EAP built into it, you can, start from there, which is going to be my last question to the three of you, actually. And then if anybody else has a question, we'll field those as well. But what would you say is a good step that you would encourage either the employer, HR professional, or the employee to take from our conversation today? So Brittany, I'll start with you. What's a good step for everybody to take after today?
Man, I have an awesome step, but it's if you have an EAP already. Is that okay?
Oh, yeah. Sure.
So if you have an EAP already, or maybe asking your spouse if they have an EAP, someone in your household, and if you do have an EAP, use it. Call the number, experience how many sessions are needed, talk to someone like Todd. I'm sure you're going to learn a lot about yourself. Experience it for yourself. It will cost you nothing. It costs your employer nothing. And it could really, one, help you, but also allow you to advocate for these programs.
Awesome. I do have an illustration of that I don't think I've shared with any of you. So in my last position, I was on staff at a church. We had, I think 15 to 20 employees, and I was the administrator. And now I look back, it's like, why didn't I ask that question sooner? But we had some changes in staff and just some stressors at the church. And I inquired, like, I've never asked that question. How many sessions? What's the cost? Are there copays? We called our insurance and found out, unbeknownst to us, had no idea, that we had unlimited sessions, no copay. I was shocked. So I immediately told everybody, hey, look at what's available here. And some of them, picked right up on that, but it took me to ask that question to find out for them. So I agree, Brittany. One of the best things you can do is just make a phone call and make sure you know everything, so you can educate and make your employees aware of what's possible for them. Dr. Dan, any ideas on some next steps for people?
Well, I think, everybody's got, as we talked about, everybody's talked about, they've got stress in our work, and it affects our employees, it affects their health, it affects their mental health, and it affects the running of their office. I think one of the things that you should do, for me, would be get with my office manager or someone and talk to them about getting an employee assistance program. What might this do? Might this be beneficial to my office? Would it be cost savings? Every manager is going to look at the bottom line on this. You're going to find that it's immensely cost saving. And not in every case, but in almost all cases, it's going to be cost savings involved there. So I would recommend looking into it. You may already have it, as you guys were talking about, but in our case, I don't believe we had that. We didn't have this component in our insurance, and each insurance might have varied with our employees. Some got it through their families, some got it through their husbands. There's other ways at which people can get insurance programs that we don't know. So help and match those, or help them get an easy foot in the door to counseling has been very beneficial to our office.
Awesome. That's a great suggestion. Todd, any thoughts?
Yeah, I would echo what Brittany said about experiencing the EAP for yourself. If anything, being a counselor for as long as I've been, it's given me a unique perspective to realize that everybody's got their thing. We all have something, and most of us have more than one thing. And so I think it would help anyone to, especially if you want to get a good experience of what your employees will experience doing that. There's no better education about counseling than being on the other side of the couch. We were told that in grad school, was of course we were all counselors, and of course most people that go into counseling probably have been in counseling or were in counseling themselves, but they would always tell us, get a counselor, see them at least once a month, because you need to have that experience of what it's like being on the other side. Until you do, boy, it's hard to really empathize. It's hard to really connect in that way. So that would be something I would suggest for those that are brave, brave enough to do it.
Yes, it does take some bravery. So
Yes, it does. Yeah,
that's right.
Absolutely.
So employers, HR professionals, when they come in, when a staff member comes in, that is one thing that I find, I'd echo that with Todd. One thing I find that you just can easily say to an employee, I know this is going to be a hard step. This takes courage. And I just, I'm here to support you. And this is why we have this program in place, to support you and encourage you for the full wholeness, wellness of yourself. So I want to thank Brittany and Dr. Dan and Todd for sharing all this wonderful information with us today. This recording will be uploaded to our YouTube channel. So if you have others that's like, hey, this is really helpful, I encourage them to check that out. And you know how to reach Brittany, Dan, and Todd. If you need to reach me, you can just call our office number at Samaritan, and my email address is john@samaritan